Hi, my name is Christy Nelson, and I'm here today to teach you about clinical emergency triage. Have you ever found yourself at the hands of an emergent situation and felt completely helpless? Have you ever been unsure of what to do, who to call, what your role is? Well, that's what I'm here to teach you today. In the clinic environment, we all play a role. We all have a level of authority and decision making that is our responsibility for every patient that walks into our clinic. But this all depends on the level of emergency that's in place. Typically, there's an emergency team of doctors and nurses that will come when called over a loudspeaker, citing an emergency. It's not always the case, but typically there's some staff that are assigned that responsibility. But how do we determine what's an emergency? How does a receptionist know when somebody walks into the clinic not feeling well and suddenly looks very pale? How do they know if that patient is truly having an emergency situation or if it's something that can just be taken care of by the doctor upon visit? There are 3 steps. There are 3 types of situation. There's a non-urgent situation, which means that the patient is there for fever, cough, preventative maintenance, removal of stitches, maybe a shot, an immunization. Urgent care means that they might be there for a suggested heart attack, a broken bone, an asthma attack, a high fever, an allergic reaction. Emergencies might be a car crash, a stroke, a cardiac arrest, excessive bleeding, a trauma injury, loss of a limb, a persistent seizure. The difference between these 3 are that emergent situations pose a life threat, an immediate threat to your life. Urgent situations require prompt care, but you have time. You can wait to be seen, to get this taken care of. You can wait hours. Non-urgent situations means that there's a condition that needs attention, but you can wait days to be seen for these situations. There's no life-threatening pose to what's going on. So now that we've broke down the 3 different methods, urgent, non-urgent, and emergent, what's the next step? A receptionist is at her desk. She takes a patient in. She gets his information. He starts to feel sick. He starts to look pale. What is her next step? Does she call the doctor? Does she call the nurse? Have him roomed right away? Does she think that this might be an urgent situation where she needs to do more? Typically, unless she's seeing some kind of intense pain voiced by the patient, a collapsing on the floor, seizure activity, profuse bleeding, it's probably not an emergency situation at this moment. However, she can certainly call a nurse to address it and determine whether this patient needs to be brought back to a room right away or further steps need to ensue to determine if the patient needs to go to the hospital or an EMS needs to be called. The first step for reception when she sees a patient is to assess the patient's tone. Determine if the patient, by their response or their level of voice and tone, is a stressful one or in pain. The second step is to determine the level of urgency for this patient to be seen. This also goes in hand with the phone staff. They answer a phone call. What is their next step? Obviously, they need to determine from the chief complaint that the patient is giving How long have they had this complaint? How long have they been feeling this way? Does it sound like it's an emergency situation? Does it sound like it's an urgent situation? Does it sound like it's a non-urgent situation and can wait to see the provider? These are things the PSR cannot decide on her own, but she can take the message. She can get the information for how long this has been going on, what the details are, and then transfer this to the triage nurse. The triage nurse then plays her role or his role, and they talk to the patient. They find out more detail about what the patient is enduring, how long it's been going on, and they then are able to determine, and it is their job as the triage nurse to determine if the patient needs to go to emergency, urgent care, or can simply just schedule an appointment to be seen. It's not always going to be the easiest way, the easiest breakdown, or the easiest way to determine these things. Sometimes you just don't know. Some things that seem like they can be seen by a doctor might start to escalate within a few minutes and become worse, and then they end up in the emergency. The biggest, most important step is 911. Don't forget to call 911. If a patient sounds under duress, they sound like they're in pain, they're stressing chest pain, or they're having excessive bleeding, they feel like this limb is falling off, they're experiencing what feels like a seizure coming on, or they start to have a seizure while on the phone, your job as the triage nurse is to pick up the phone, the secondary phone, and contact 911, have EMS brought to that patient's home right away. So if we follow these steps and we play our role, we can make sure that every patient is taken care of and managed in the proper way. We can make sure that we are doing our job and following protocol the best to our ability and saving lives. Communication is key. Communication saves lives. Without communication and the proper channels of communication, our job becomes more difficult, and we just might put a patient in jeopardy. So remember, follow the steps. Listen to the patient's tone of voice. Ask about the level of urgency. If you can't get an answer, determine it on your own by the way they look, by the way they sound, by what is occurring in front of you or over the phone. And call 911 if you need to. Thank you. Have a great night.